for Mobile County Health Department. Today we will go through, it's Friday, we'll go through the COVID numbers. So globally, we're at 57,245,000 cases with 1,366,000 deaths. In the U.S., we have surpassed the 11 million mark and are approaching the 12 million. So we're at 11,789,034 cases with 253,309 deaths. In the state of Alabama, we're at 228,373 cases with 3,451 deaths. So in our COVID report that was published today, our COVID cases for Mobile County are at 19,195. That was an increase of 136 in the last 24 hours. This is a trend that has been consistent over the last few days, where we have seen numbers in the 120s and 130s in terms of new cases. Our deaths are at 359. That's an increase of 1 in the last 24 hours. Our hospitalizations are up 10 to 2,494. In terms of demographics, we continue to see the same demographic trend, with females comprising more of a higher percentage of cases when compared to males. We still see the pronounced age distribution where the 25 to 49-year-old age group percentage-wise is contributing the greatest number of cases, with the 65 and over contributing the greatest number to our mortality numbers. Continuing with hospitalizations, and when we say currently hospitalized, what that means is, although we had an increase of 10 in the last 24 hours, what happens is they look at a point in time in the hospitals and they report how many COVID cases are currently hospitalized. So it's what was called a point prevalence. We had no increase actually in the last 24 hours. So we maintained our current hospitalization count of at 86. If you look at our numbers over the last week, we did go over 100 earlier in the week, and we're in the high 90s for 4 of those 5 days. In the state of Alabama, the risk status for Alabama counties was published today. Mobile moved up to the high category, and Baldwin County is now in the very high category. So I'll remind you what this is based on. It's based on 4 measures. One is meeting testing goals. All counties for every Friday have met that goal. We met our emergency room as well as our case goals. What we failed on was our percent positives. So if you look at our percent positives from our Monday expanded report, you can see that the percent positives have been going up. We also communicate fairly often that these are based on the traditional PCR test. If we look at the tests that are done in our urgent care facilities, those percentages are in the 19 to 20% positivity range. And the theory that we have is that those individuals that think they are at higher risk for COVID transmission are more likely to go for testing that will give you a quicker turnaround. In terms of complaints, this last week we did have 3 complaints from food services, 1 from daycares. We didn't have any in our school systems. We had 3 from retail for a total of 7. If we look at our totals to date, we have 185 in our restaurant and food service industry, 10 in daycare, 5 in schools, and 80 in retail, giving us a grand total of 280 cases. All right, so let me go to the questions from the media. We've had a lot of questions around the tree lighting ceremony in Fairhope last night, as well as the upcoming tree lighting in Mobile tonight. So one of our questions is basically many of the attendees were not wearing masks, and by looking at the videos, it was obviously that social distancing was not occurring. And the question is, should these be further monitored or restricted? So let me start off by saying that the data for mask is unequivocal at this point. So those that still have questions around whether masks work or COVID is some kind of conspiracy, that is just not under discussion anymore. So there was a recent publication by CDC that showed that areas that had a mask mandate and the mask mandate was enforced, their transmission rates went down by 4%. If you look at areas where the masking was not enforced and there was not a mask mandate, their transmission rates went up 100%. So let's be clear, masking works. And when you combine that with social distancing, you dramatically reduce COVID-19 transmission. So if you're at one of these events and you still don't get it, that you need to be wearing a mask to protect yourself and those around you, you are not doing the service that you should for your community. So there was another comment here around people stating essentially that most people that contract COVID are going to recover from it. That's absolutely true. If we look at polio, 90% of those that contracted polio recovered. It was 10% where there was an issue. Okay? My question back to you for everyone that has that stance is, how many people do you have to put in the hospital? And how many people do you have to put in the morgue before you get it that you need to be wearing a mask and you need to socially distance? The next question is whether the medical community should be more in contact with civic leaders and how these events should be handled. So it's very clear that we're still under a safer at home measure where the responsibility of maintaining socially distanced and mask orders is on the event holders. So if you cannot maintain this, the governor's orders are very clear that these events should not be happening. But look, these events certainly can happen. It's those that cannot figure out that they need to be wearing a mask and they need to socially distance is the problem. And if this continues, our numbers are going to continue to go up, and we'll stand up here every week and tell you guys that we have no good news. The next question is again about the Mobile County tree lighting tonight, asking should these events be policed. So because we are under a safer at home order, there are financial penalties associated with not wearing masks. These are typically not enforced. However, I would say that if anyone is having an event and you cannot guarantee people are going to adhere to these mitigation issues, you really need to think on a moral level whether you should be having these events. Okay, so we'll move on to some more happy questions. So one question that came out of our school report that we put in our expanded report on Monday was asking about the kids that are included. So what our reports basically collect is a little different than what Mobile County Public School System has on their website, and even the Alabama Department of Public Health has on theirs. So we're able to actually look across all schools, not just public. So we get information from every school that is reporting information into Alabama Department of Health, as well as we have information from some of the urgent care facilities with respect to the schools that the children are attending. So our report actually covers all ages, so elementary, middle school, high school. It also covers teachers and staff. So when we give you the numbers on the expanded report, those numbers with respect to what we've seen in a week, the number of cases that are active, meaning they're within their 10-day isolation period, that covers all the schools that are out there. Our next question is asking about, do we think we'll be shut down again? And I've actually had questions about both at a community level, we'll see businesses being shut down, and we'll be seeing restaurants and bars, for example, that were shut down earlier, as well as are the schools going to be shut down after the Thanksgiving break. So currently, our numbers are not as bad as what we're seeing in other areas like North Alabama. So if we can maintain our masking, maintaining the social distance and the mitigation activities, we don't have to shut these areas down. It's only when we don't do the mitigation activities that these businesses are at risk. So let me now address the schools, because there was a rumor earlier in the week that was circulating that Mobile County Public Schools were not going to go back after the Thanksgiving break. I can tell you by looking at the numbers that school is probably one of the safest places you can have your children in terms of preventing COVID transmission. And it's because while they are in school, the administrators, the nurses, the teachers are very, very diligent in making sure that the kids are wearing their mask and socially distancing, and they're cleaning the desk, etc. So we actually don't document very many in-school transmissions. It looks like what happens is that the transmissions that are occurring in the community end up showing in the schools because kids are going out to McDonald's and Foozackley's and eating together, and that's where they're not adhering to the mask orders and the social distancing. So the schools are doing a great job, especially compared to some of our northern counterparts. You may also have heard where New York City is shutting down their schools. That is based on a marker that they put based on their percent positivity of 3%. So when they decided to reopen schools, they agreed with the teachers union that if they could get the percent positives below 3%, they would open the schools, and then if it got back above 3%, they would close. And that's what you're seeing in New York City. Next question is there anything we can do about organizations and churches who continue to hold large gatherings with no mask required and no social distancing? So what I would recommend in terms of something to be done is let us know. Call Mobile County Health Department. Let us know. You can call or email our complaint line at covid19@mchd.org. If you'll give us that information, we reach out to these organizations, churches, schools, restaurants, and our role is really to help educate them. I really have found in no instance when we did reach out, we explain the situation, that all these organizations and businesses have been extremely responsive because they want to maintain you guys coming back. They don't want to lose customers with people being sick. And so let us know, let us reach out and do the education. Our next question is on basically household gatherings. So this one specifically is they have 3 families. They get together to eat. Nobody's positive, but should they continue to do that now that the numbers are going up? So you have to be very careful and think about how diseases are transmitted. So each individual person within the family is a potential point of transmission. And so it really, unless you're living in that same household and you're really kind of isolating together, you have to think about what happens when you're mixing with other households, even if they're blood family. And so we encourage that you do socially distance, you do wear the mask. As you're sitting and having the dinner, put space between you. And it's very, I think, opportune for us to talk about this because Thanksgiving is coming up. And think about how you're having your Thanksgiving feast. Think about if you should distance yourself. Think about the mask wearing. As you're eating, take it down. And look, if you have family members that are over 65 or have comorbid conditions that put them at risk of more deleterious or bad outcomes with COVID, think about a Zoom call. I know it hurts, but it's better to put them on Zoom right now than put them in the grave at Christmas because they've got COVID and they didn't make it. Okay, so also thinking about the holidays, and in particular Thanksgiving, Mobile County Health Department is embarking on what's called Know Before You Go. And what this is, it's a campaign that we are leading tomorrow, Saturday, November 21st. We have 6 sites here in the Mobile County area, and we are offering free COVID-19 testing. And we're using a brand new technology that's called Binex Now. And what's interesting about Binex Now is it doesn't require a machine to run through, so to run the samples through. We can do it within a little card, so we're not waiting on a machine to process these samples. And also, the Binex Nows don't require those deep nasal swabs that are so uncomfortable. It really is a swab that comes right below your bone in your nose, so it's not a deep swab. So it's much more comfortable than feeling like you're having your head shoved underwater. So the areas that we're offering testing is we're offering on our Dauphin Island Parkway Health Center that's at 2601 Dauphin Island Parkway, at our Sims Health Center on Wolf Road, our 8 Mile Health Center, which is on St. Stephen's Road in 8 Mile, our North Mobile Health Center in the parking lot, that's at East Coy Smith Highway in Mount Vernon, our Women's Center in the parking lot, which is 248 Cox Street, and then at Keeler, which is down here on North Bayou. Now, the Keeler building on North Bayou, we're running the testing from 8 a.m. until noon. All the other sites are running their tests from 10 a.m. to 2 p.m. So we really do encourage you to get tested. That way, if you are positive, you know that you do need to isolate and stay away from your family members during the upcoming holiday season. If you should test negative and you're showing symptoms, or if you're not showing symptoms and you test positive, we'll give you the information in terms of what the next steps should be. So these are drive-up clinics. We are offering appointments, so if you want to give us a call and make an appointment, we'll accommodate you, but we want you to drive up as well. Please come down. We have 200 tests at each site. We can get you in and out fairly quickly. It's about 15 minutes to do it. Again, if you test positive, we'll give you some additional information about what you need to be doing. But please come down, know before you go, and really this will help really help in terms of reducing transmission of COVID-19. We can also help you with understanding what to do with your family members if they're close contacts, but we're really trying to protect those that are at higher risk for bad outcomes, especially when we have the holidays coming up. So that's what I have for today. Mark, are there any other questions that I missed? Okay. Thanks, everyone. We'll have our expanded report on Monday. We look forward to seeing everybody then. So thank you very much.